Hi, my name's Anna Watkin and I'm an ST4 in South Yorkshire, and I've been asked to speak to you today about ST3 training in Yorkshire and the Humber. So just to start with, this slide has just got a clip of the Yorkshire and the Humber anaesthetic homepage that can be quite useful to go to for any questions that you've got as a starting point. It's got plenty of information on courses, on ARCP, on units of training, lots of just bits that you might want to have a look through. So I've just popped the website link at the bottom there. So some of you have probably worked at a registrar level, maybe in a year out, maybe you've been spending quite a long time working as a staff grade, now you're coming back into training. But for some of you, this will be your first year out of CT, and you might be feeling a little bit nervous about the step up to registrar. But don't worry, this is completely normal. Everybody feels nervous, but everybody settles in very quickly. It can feel a little bit strange. Suddenly, not only are you trying to juggle covering maybe ITU, obstetrics, maybe you're in neuro or cardiac and it's an area that you've got no experience of, but often you've also now got an SHO who's looking to you for help. But don't feel like you're on your own. There's always somebody else that you can ask for help. There's often another registrar in the hospital, often with more experience than you have. But also you've always got your on-call consultant, and they really won't mind you calling. You don't have to go it alone. It's pretty much the same setup as any step up that you've done before. Use the nurses, they've been doing the job for ages, they know the unit, they know how things work. Be nice, ask, and I'm sure they'll look after you. And most regions tend to have a WhatsApp group for trainees, so this is a pretty good thing to join, both to keep up to date with what's happening, but also a way to meet the other registrars in the region. And it's often quite a good resource of information from people who are ahead of you and have done it all before. So, in terms of intermediate training and getting your units signed off, I think the best bit of advice that I can give you here is to always speak to the module lead at the beginning. They've quite often got specific workplace-based assessments or lists that they want you to be on, and the earlier you know about this, the easier it is to go ahead and get this signed off without too much of a hitch. Think about what you need to get done in this particular time period. So some modules you could do anywhere, things like critical incidents transfer, they can be done in DGHs and tertiary centres. Things like transfer you're going to find very easy to get signed off in neuro, but also probably while you're doing your general block somewhere as well. That's in comparison to other modules such as neurocardiac, where you're going to have a specific 3-month block in that specialty to get it signed off, and these are ones that you're not going to be able to go back and look at again later. So there's a whole host of modules to get signed off in your 2 years of intermediate. The biggest one, the hardest one to sign off, tends to be the general module. So you'll get 6 months for this. Most people tend to do it in a DGH. And for this one, it's really important that you look at your module outcomes right from the beginning. It's very, very difficult to go back once you've moved on to another rotation and get this signed off. Plan ahead. So as we said on previous slides, speak to the people who sign off each unit, make sure you know exactly what they want you to do. When you turn up to your list, have an idea of which assessments you're missing, which ones you might want to pick up on that day. It's also worth looking ahead at what people might need you to do. For example, for my perioperative unit, I had to go to a certain number of CPEC sessions, a certain number of perioperative sessions for the pre-op clinic. And if I hadn't have been asking the rota coordinator to get onto these, I might not have got what the unit lead was looking for. So just don't be afraid to speak to your rota coordinators. If you know what you're missing, you're going to know much better than them, and they'll be more than happy to help switch your lists around. You know, if you've done a month's worth of urology but absolutely no gynae, just let them know and they can start moving your lists. And just have a little look every week at where you think you are. Have you got any big gaps? Are there any areas that you haven't covered at all yet that perhaps you need to start shifting your focus onto? And if you approach it in this manner, then you're probably not going to get a horrible surprise towards the end when you realise that there's a whole unit that you haven't done anything about. So in terms of your ITU module, this will run in 3 months. Have a look at the Annex F beforehand. It's the same document that you used for your core training, but now you'll be moving on to the intermediate part of Annex F. It's really important to start cross-linking here. You only need about 4 or 5 cases, and then you'll be able to cross-link them across a large part of the curriculum for ITU. Also, it's worth having a look at your additional competencies. So this is just below the mandatory ones in the Annex F document. You don't have to do anything with them, but if you start finding that you're doing them, they're a useful thing to get signed off because you can carry them forwards. This particularly is if people are wanting to look at dual training, you can fall back on this later so you've got less to catch up on. Also, don't forget that what you do on your on calls, even if you're on a general block, that still counts. So still get assessments, still keep a logbook, still link that to things. Everything counts. So in terms of your specialist blocks, you're going to have your neuro, cardiac, obstetrics, paediatrics, and pain. These will be delivered slightly differently across the regions, but for the most part, you can expect to get a 3-month rotation in these individually. They're delivered as individual blocks. So again, make sure that you've spoken to your trainee lead at the beginning to find out what they want you to have. Are there any specific lists again? Because these are the ones that you're really going to struggle to go back and to cover when you're in the DGHs afterwards. So you really do need to plan in advance. And I'm aware that I'm saying this time and time again, but cross-link everything. You can cover your sedation in intensive care, in trauma, in neuro. Make sure you're linking these so that it helps you when you're coming to get them signed off. I'm not going to read through all of these, but I'll just leave that there for 2 seconds so that you can have a look. And as I mentioned before, depending on where you're doing each year of your training, some of the modules are delivered differently across the regions. So for example, getting your trauma block signed off, if you're doing a period in Leeds, then that will be signed off as a dedicated module. You'll have a 3-month block in it. However, in South, you're going to be picking that up a little bit in your DGH rotations and then alongside your cardiac rotation when you carry the trauma bleep on call, but you're not going to get a 3-month section of just doing trauma. And again, in East, you'll pick it up, but this time it tends to be alongside ITU. So it's probably worth just speaking to people in your region and getting an idea of how to get things signed off. Also, just think ahead if you're doing one of your intermediate years in one region and one in another, make sure that you don't get caught out by not covering that specific trauma module if you meant to get it as a dedicated block. And again, just go through everything at the start, make sure you know what you need to get, make sure you're planning ahead and keep reviewing this. So I'm sure that the vast majority of you are familiar with the lifelong learning platform and how to do workplace-based assessments and logbooks, but I'll just give this a quick run through. So if you don't have one already, then you need to email the college. It's very easy. If you go on their website, then it gives you all of the details of how to get in touch with them and they'll set you up an account on the lifelong learning. And just do this straight away because you're going to be using this throughout the rest of your career, including as a consultant. The biggest tip is keeping it up to date all the time. You really don't want to make the mistake that I did at the beginning of not filling in for 3 months and then spending about 3 hours one evening sitting going through the logbooks of everything on the computers and trying to backdate it all. It's just not an easy way to do things at all. Also keep things uploaded. So if you go on a course and then you get emailed a certificate, that might be part of the regional teaching, it might be a course that you've specifically organised going on, but when that certificate lands in your inbox, just upload it straight away because then you're not searching back through your emails or forgetting that you've done the course and it's all just where you need it. Makes your ARCP a lot easier and also your module sign-offs a lot easier as well. And don't forget to have a look at Annex G, so that's the things like our teaching and management. While people tend to properly fill this in post-exams, so more into your higher block, having a look at it now and starting to fill things in as you're doing them, it doesn't hurt. So I've just put up a little picture here of what your logbook will start to look like on lifelong learning. So as you fill them in, you'll be getting things in red that you haven't started. You'll have your units that are in progress in yellow. I mean, it's all pretty self-explanatory. And this is what it looks like when you just go through an overview. It will tell you how you're doing with each module. It'll tell you how many workplace-based assessments you've got, how many they recommend that you have. So it's just quite a nice overview of where you stand with things. And just to really push home this point, just try and get an assessment done every day that you're in on a training day or on an on-call day and cross-link these to more than one curriculum point. Okay, so we've already said make sure you keep your logbook up to date, be that at the end of a list after each case, at the end of the week, just work out what works for you and then stick to it. And as I've said, don't do it at the end of a 3-month block because you're never going to remember everything. And it just makes it so much easier to prove that you've reached all of your goals. One thing that you probably do want to spend just a little bit of time working out, and again, you probably will have done if you've already done core training using this, just make sure that you've got a way of adding things to your logbook that's consistent, so it's really easy to filter them when you want to send a list of things to the unit sign off. So for example, for transfers, I would always enter them as a ICM case and as an event, and then you can just put it as an intra or inter-hospital transfer. That's easy to filter down. For sedation, if you always put it under your mode of anaesthesia, again, you'll easily be able to filter it off when you come to asking for your sedation to be signed off. So, ARCP. Again, it runs very, very similarly to core, and you'll have one at the end of ST3, one at the end of ST4, and your ST4 will be the one to move through to higher. So, I've just popped this on the bottom here, and that's from the website that I gave you the address of right at the beginning. And it's quite useful for ARCP. It'll put all the checklists. It's probably worth having a look at those before you get into ARCP period, maybe at the beginning of the year and a couple of times throughout. Just make sure that you're keeping up to date with it. There's nothing that you should have in place that you haven't done. Remember that you need to be doing an audit or a quality improvement project every year. The exception to this is if you're doing an exam, but even if you are and you can fit something in, that's ideal. You'll get sent your GMC and your trainee surveys every year. Don't forget to complete these, keep a receipt. As I said, upload that receipt the second that you've done them. You will need these to get through your ARCP. And the ARCP checklist will be sent out to you near the time. Make sure that you use it. It is really good for helping you keep yourself on track and making sure that you're not missing some major thing that you weren't even aware of, just as you're due to send your ESSR at the end of the year. So I haven't done my year out of region yet. I'm due to do it for ST5, but I've spoken to some of my colleagues who have done it, and these are some of their top tips. So they said you'll be fostered by the region that you're working in at the time. So that often means that your teaching will be in your host region, not your parent region. And think about what you want to do for accommodation. Obviously, everybody's in different positions. Some people have commitments and just aren't able to move into the region. But just bear in mind that that commute can be pretty long and hard after a set of hard nights going backwards and forwards between the regions. So just have a plan for what you're going to do if you're not really feeling up to doing the drive. Consider doing any meetings with your educational supervisors over FaceTime, Zoom, whatever you've got used to during COVID. We've all got very used to doing that now. Overall, most of them said they have enjoyed their experience. It's broadened their horizons. They've looked at different ways of doing things, potential different places to work in consultant posts. But they do say the commute is difficult, so just be prepared for that and have a plan for how you're going to manage that. So, useful courses. The Deanery gives us a list of courses that they strongly recommend. They recommend that they'll fund. So again, going back to that Deanery webpage, there's this section on courses. So I've just put up a little table here from the website with a list of the courses that are recommended by the Deanery. The main thing with courses, I think, is try and have a think if there's a unit that you're struggling to get signed off. Can you find a course that would feed into this? The Awake Fibre Optic Intubation course is very good. It's strongly recommended. It's fully acceptable to use that as part of your assessments for your airway management module. There's also trauma courses if you're struggling to get your trauma signed off. Just have a think and see if you can find a course that links into anything that you're struggling with a little bit. Sheffield runs a trauma course, but there's also other trauma courses run across the region. So just keep an eye on your emails. You'll find that you get invites to lots of different things throughout the year, and just apply for them as and when you feel that they're useful for you. But also think about if a course isn't on the list. That doesn't mean that it can't be funded. Just get in touch with the TPD for your region and ask them. You may find that they're happy to fund that for you. Teaching opportunities, you'll often find that there's weekly teaching in your base hospital that you'll be released from your lists for, or your ITU commitments. And then there's often regional teaching on a monthly basis, sometimes just for the registrars, sometimes it's mixed with the core trainees and the registrars. It includes things like journal clubs, It's a good way to try and get some local presentations signed off, some teaching signed off. There's also the Yorkshire Anaesthetic Trainee Conference that runs once a year, and that's pan-deanery. I'm not sure where it's set to be this year, but I'm sure we'll be getting some more information soon. Particularly if you're looking to get a poster done this year, that's a really good way of trying to get involved with that. They're really keen to have posters presented. Everything has been a bit disrupted with COVID. It's starting to get back to normal a little bit, but in the interim there's a lot of Zoom-based teaching, and you're often able to get released from your lists if there's something that you want to go along and take part in. So the dreaded final. It's mapped to intermediate training, and essentially what that really means is don't try and sit it too soon. It's meant to test what you've learned in your intermediate training, so there's no point doing it after 3 months of general in a district general hospital when you've not seen any of the specialties. If you're starting out with 9 months at a DGH, which is what I did, that's not a problem. Just consider trying to get some tasters. The college tutors in each area are often quite happy to help you get in touch with the tertiary centres to try and see things like a bit of neuro, giving a neuro anaesthetic, some of the positioning that comes with that, seeing somebody go on to bypass, putting in a double lumen tube, just all the stuff that you've never seen before and is absolutely impossible to talk about without having seen it. In terms of just some of the sort of logistics of it, you need to pass your final within 7 years of your primary, and you want to be aiming to pass it before you enter ST5. Technically, that's meant to be something that you completed before you move through to higher, but actually you can move forwards into your ST5, but it requires a lot of discussion with supervisors. It's not an ideal situation to end up in, and you have a maximum of 6 attempts at the exam. There's lots of courses that are running across each region to help. So for example, in South Yorkshire, there's Paddy's course. So that's for the written exam prep. It runs once a week for approximately 12 weeks before the exam. Lots of consultants come in and give you teaching in their area of expertise, and you also will do weekly CRQs that are marked and given back the next week, and then everybody discusses, and also weekly SBAs, and it has a really good pass rate. Paddy does try to accommodate trainees from every region, but it does depend on the numbers, and priority is unfortunately given to the South trainees. It does have a very high pass rate. Once you've moved through that, there's a Viva course that's also run in South Yorkshire. Across the other regions, so East has a 2-day written course that's open to everybody, and then moving through to the Viva, there's a 2-day intensive course run by one of the trainees there, Dave Taylor. He's got actual examiners coming in to go through that. It's open to people from every single region, and he tells me that the dates will be up once the exam dates are confirmed on the deanery website that I keep referencing. There's also the Royal College of Anaesthetists course that's run once a year down in London. So just a little note on COVID. Obviously, we don't know how this will roll over to when you try and sit the final. The written is now over 2 days instead of one. You sit the CRQ on one day, and then at the end of the week you sit the MCQ, which is just torture if you ask me, but that's what we have to do now. It's done online, which has posed all kind of problems, but essentially have a think about where you want to be doing it. And there's a high possibility that this will carry on into 2021 and probably beyond. I think the college is really just talking about going online for the written from now on. It's unclear how the Viva will run, but I think from what they've recently said is probably also going to be done on Zoom. The FRCA course is running online at the moment because of social distancing. It's only £50, so if you're thinking about sitting the final, although remember, maybe don't think about doing it straight away, it is a good source of material to get your hands on. So that's my brief summary of ST3 training in Yorkshire and the Humber. I've put my email address up there. I'm happy for anybody to get in touch with me if they've got any questions that I haven't covered now. I'm aware some of it was a bit of a whistle-stop tour. But if anybody's got any questions, then please ask away and I will try and answer them. If there's anything that I can't answer, then I'm sure the TPDs are happy to jump in and help me as well.